Hello, everyone. My name is Simiran Choudhary, and I'm delighted to welcome you all to today's special session titled Think Pink, Act Now, Screen, Fight, and Win, organized by Voice of Healthcare and proudly supported by Cadila Oncology to mark the occasion of International Women's Day 2025. As we celebrate the strength, resilience, and remarkable contribution for women across the globe, it is equally important to shed light on the critical health issues faced by women, one of them being cancer. This session aims to emphasize the importance of early detection, routine screening, timely treatment, and creating widespread awareness to improve cancer survival rates among women. And today we are truly honored to have with us Dr. Rajkumar Ramaswamy, medical oncologist at Velammal Specialty Hospital, a highly esteemed expert dedicated to cancer care, patient advocacy, and advancing treatment protocols. With his exceptional expertise and unwavering commitment, Dr. Rajkumar has played a pivotal role in transforming cancer care by ensuring timely diagnosis, personalized treatment, and compassionate support, ultimately improving patient outcomes and quality of life. Welcome to our show, sir. It's a pleasure to have you with us.
Good afternoon, everybody, and thank you, Simran, for the nice introduction. I'm honored to be part of the Cancer
Thank you so much, sir. So, in today's session, we will discuss early detection, breaking screening barriers, advancements in cancer care, and how women can take charge of their health. So, our goal is to inspire awareness, encourage women for regular checkups, and to reduce the fear of cancer. So, without any delay, I would like to start our conversation with Dr. Rajkumar. So, I would like to know, why is early detection so critical in improving cancer survival rates? And can you share any real life cases where early diagnosis have made a significant difference in getting it treated with less complexity?
cancer is now becoming a huge epidemic on the horizon in India, and cancer is going to affect each and every family member, and especially in a woman. The breast cancer is the number one, and the cervical cancer becomes the second, and the lung cancers. These are all the common cancers which the woman is going to encounter in their most active period in their life. In India, the cancers affects the young and middle age people, unlike in the Western population where it affects 70 plus or 60 plus people. So it affects the most highly productive part of the life of a woman. And early detection helps in mitigating these huge epidemics and decreasing the mortality and increasing the survival of the patients. The survival difference, what we call in the cancer, is the 5 year survival rates. The survival difference between a stage one, two, three, four are precipitously huge. Example, in a case of a breast cancer, the 5 year survival rate in a stage one breast cancer is going to be 90 to 95%. You don't believe it? A person with a stage one breast cancer can be detected in a, if it is able to be detected in a stage one, can be definitely cured by 90% of the time. That means out of 100 people, 90 to 95% of the people can survive up to more than 5 years and can be cured of the disease if the disease is detected in the stage one stage. But if you take the same woman, if she is affected with the breast cancer and she has been detected in a stage four disease, these 5 year survival rates depends upon the molecular feature in precipitously drops below 30%. So that's a huge difference between detection, early detection, and the detection in an advanced stage. In my 15 years of my career, I have so much of patients to look after, and we know that these patients can be cured, and all the complications arising out of the complex treatment also can be lessened if it is directed in the early part of the disease. Unlike in an advanced stage, the stage one and the stage two disease are called the early stage, and stage three and stage four are called the advanced stage in a breast cancer. Same it holds across all the site specific of all the cervical cancer or anything. So this much huge difference is there between a stage one and a stage four disease. So is always it's the screening helps in detecting the early part of the disease, and the treatment is also very simple if it is done in the early part of the disease, and the survival also can be very high as 90 to 95% of the breast cancer, and it varies across all the, even in lung cancer, the survival rate can be as high as 70 to 80%. So this huge difference occurs between the different stages of the disease.
Thank you so much, sir, for explaining that to us and emphasizing on the importance of why early detection is so crucial. How we should motivate more and more women to come out for the screening process, and how it will make a complete different, the difference in the treatment process as well. Sir, despite knowing all those things, we believe there are many barriers in preventing women from undergoing regular screenings like mammograms, pap smear, or genetic testing. So, how can we break these barriers, especially in rural or underserved communities where the awareness level or the education is much lower as compared to the urban cities?
Number one, when you compare to the metro where the awareness is great and the modalities of screenings are also readily available at the doorstep, the rural populations are in the different segment where the opportunity screenings are very important. The government of India, as well as all the state governments, especially our part, the Tamil Nadu government, has taken these opportunity screening where the women of any age group, when they visit the primary health center or the first contact for various ailments, for even for innocuous like fever and all, they will be subjected to a pap smear if they are 45 years of age, or for undergo a mammogram, or taught about the self breast examination of the breast when they reach the age of 45. This is what is called an opportunistic screening. So we cannot make all the tools of the screening, as unlike in a Western population, to be available in the doorstep of the rural population. For that, we have made this opportunity screening whenever they have the opportunity to visit this first point of contact, the primary health center, or the first point of a healthcare worker, or even at the hospital. They will be subjected to these kind of screening. These helps in identifying the lesions very early. Example, the viabilis and the one methods which we have been developed in the developing countries is very useful to identify the cervical cancer when they come for different ailments to the first point of contact, the rural health center. They will be subjected to the viabili, even they may not have any symptoms, and they may be taught the initial steps of how to detect the lump in the breast with the help of a self breast examination, as well as if the mammogram is available in the center, they can be referred to a higher centers where mammogram is available when the healthcare personnel happens to detect the lump in the breast. So this is what's called opportunity scanning. This is found to be very successful in developing country where all the tools of the screening may not be available in other rural setups. So this is very useful, and the rural population can be motivated to undergo this opportunity screening at the very earliest if they reach by the age of 40 to 45.
Yes, sir, definitely. It becomes very important at that particular age when they reach to 40 to 45. And there are many myths attached to it. The myths and the misinformation around the head of women about screening. So whatever little bit of I heard, I believe you would heard, many other logics behind this, many other excuses. Like, if you go for biopsy, it may spread. If you go to the screening process, if it is not there, it may come out, and there will be a lot more of appointments, ye doctor, that doctor, all these things. So how can healthcare professional encourage to females out there for routine checkups without causing that unnecessary anxiety on them?
So for that only the IEC is very important. The dissemination of the knowledge to the more remote part of our country is there's the platform like this what we are trying to do now. So these kind of we have also talked. I have personally have visited many factories, schools, colleges, as well as the any rural households we have visited and try to create the disseminate this knowledge that doing a biopsy is not going to advance the disease, is not going to disseminate the disease. This is there are so many popular and misconceptions, myths are there in the society which are perpetrated by the social media also. But we try to conduct so many awareness talks and the classes for the people so that in the factory workers in the hinterland of our state, so that they get the dissemination of this knowledge occurs to the grassroots level, that cancer, if it is detected early, it's curable. 50% of the cancers can be cured, and 50% of the cancers can be managed. Cancer can affect any person with the, of any age group. I have seen patients with the 3 months old babies to the 90-year-old ladies. So any age can be, but most commonly in India, the cancers occurs between 40 to 50 years of age. So the early screening programs are very successful if you are able to catch the people between 30 to 50, especially the breast and the cervical cancer. So any patient who comes to the reaches the age of 40, they are supposed to undergo the annual screening programs which are being recommended by the government of India as well as the various state governments. So these are the things. The dissemination of knowledge is very important, and this what people like you are doing it with the help of the pharmaceutical companies, and we also try to do those kind of things that disseminates those knowledges, and disbeliefs and myths and conceptions are all slowly has to be removed from the society.
So definitely, and also without you, it won't be possible because we need experienced healthcare professionals to disseminate this information to educate our listeners out there. So thank you so much for coming to our platform. Also, sir, like you discussed that it can happen to anyone, from a baby to an adolescent to an adult or to an old person. But most probably, the prone areas are 30 to 50 years of people. So I just want to know, does the role of family history play in determining a woman's cancer risk, and how can the genetic testing help in this proactive healthcare approach to get it screened?
The cancer is driven mostly by 80% of the cancer are caused are driven by the environmental factors. So only 10 to 15% is hereditary in nature. That means is inherited. If your mother is having, your sister is having, your cousin is having, first degree relative or second degree relative is having, the chance of the daughter, son are getting the cancers is 10 to 15%. So majority of the cancers are environmental related. It depends upon the what kind you consume, what kind of air you what kind of pollution pollutants you come across, what kind of soil you are living, what kind of water you are drinking, how contaminated it is, how polluted it is all dependent. 80% of the cancers are related to the environmental factors, is nothing to do with the heredity. So only 10 to 15% of the patients do have a risk of inheriting the cancer from their mother or father or from the first degree relatives. So that is why that component is minority in nature. Majority is how you are leading your life, how healthy is your lifestyle, how healthy you are leading an adult life, as well as in the you are how healthy you are raising your kids and away from the junk foods and the other um, uh, high calorie dense foods. So this all depends upon your lifestyle behavior, how far you are smoking, how far you are taking alcohol, how far you are vaccinating properly. Those this all depends upon the environment. So only 10 to 50% of the patients do inherit the disease from their mother or father. They may require a genetic disease, but that is a minority of the patients. So these information has to be disseminated. The cancer is inheritable only in minority of the patients. Majority, they because of their lifestyle, what kind of lifestyle they lead, the sedentary lifestyle with the high calorie dense food, with the so much of alcohol and tobacco, that is responsible the drivers for the cancer rather than inheriting the genetic one. But the minority of the people, you require a genetic test, which can be done now with the point of contact. You can do it in any lab. If they have a high risk, the mother is having some kind of a genetically driven cancers, breast cancer or any cancers which are genetically driven one, they have a high risk of inheriting the thing, then they can go a periodic genetic testing to identify whether these patients have inherited those kind of genes, and this can be detected very early in the age, at the age of 20, 30 and all. But that's a minority. Majority is also how you lead your life. Your lifestyle matters.
Rightly said, sir, lifestyle matters, and thank you so much for bifurcating and telling us how what to work on more rather than worrying about, oh, in my family history it was there. Yes, definitely it is also very important to disclose this to your doctors or go for regular screening if you have a family history. But importantly, a person has to also focus on the lifestyle, the kind of lifestyle that they are living, so that they can work on to lead a healthy, happy life there. So now focusing our shifting our focus to the treatment option, what do you think are some of the most promising breakthroughs in the breast cancer, cervical cancer, or ovarian cancer treatments today we have? Since we know that how much of AI advancements and technologies are helping us, to evolve every day.
The science has improved, leaped enormously since for the past 20 to 30 years. It's a very exciting time to be in the field of oncology. Huge advancements has happened in the field of oncology, and we are able to make the treatment less toxic, make the treatment more patient friendly. Unlike in the era of 20 to 30 years back, when the treatment was more complex, is associated with so much of toxicity. Now we can deliver those kind of treatment in a more precise way and more personalized way, resulting in less toxicity, more patient friendly. Example, the chemotherapy, if you take a chemotherapy, which I am a specialist in that, earlier we were giving conventional chemotherapy drugs, which will kill all the cells, all multiplying cells will be killed, whether it's a cancer cells or a normal cells, leading to so much of toxicity like hair loss, mucositis, severe ulcerations in the mouth, anal canal, a fever with the bone marrow suppression leading to fever, and even sometimes mortality. So these kind of conventional chemotherapy, we have moved to more specific targeted agents from 2000 onwards, where the specific pathways by which the cancers are driven. These pathways have been identified, and the designer molecules have been identified, which helps in blocking these pathways. This is what's called the targeted therapy. From 2000 onwards, we are in the era of targeted therapy. And then from 2015 onwards, now we are in the era of immunotherapy. Immunotherapy is a very important modality of treatment right now. We have this the latest cutting edge technology drugs which we have, which help in boosting our immune system to fight against the cancer. So cancer is primarily occurs. Why? Because it occurs because of the immune dysfunctions. The immune cells, which acts as the policeman of our body, where these cancers are makes the immune system dysfunctional. That's why the cancer cells are proliferating rapidly, unlike the taking over the normal cells. But if you are able to give drugs which can boost your immunity and make the dysfunctional immune system to get reactivated, and these can identify the immune systems once again can identify the abnormal cells, the cancer cells from the normal cells, and able to target them and kill them. This is what's called immunotherapy. From 2015 onwards, we are in the era of immunotherapy, which has got less side effects compared to the conventional chemotherapy, and the survival rates and the response rates, survival rates are improved a lot with the immunotherapy. This is regarding the chemotherapy. Then radiation. For radiation, we have earlier we were using the 3D CRT, COBOL, telecobol machines, and all, which were non-conformity. Now we have more precise IMRTs, IHGRTs, and proton therapies, which is more precise. It targets delineates the tumor and targets the tumor alone, sparing the normal organ or the vital organs nearby. That way, the toxicities are reduced. And surgery has grown, enormously. It has moved forward, leaped forward so much. Now people are doing tele surgeries. People, a surgeon in Delhi can do operate a tumor in Madurai. The expertise are there. The telesurgeries have been done in India. This is kind of a robotic surgery, telesurgeries, and all kind of advancement has happened in the surgery. So all the fields of oncology, these are the main pillars of the oncology: the chemotherapy, radiation, as well as the surgery, has leaps and grown leaps and bounds in the last 3 decades. So now any patient, whatever may be the stage of the disease, the treatment offered for them both in the diagnosis and treatment. What we are talked is only treatment. The diagnosis part has improved enormously. We have now biopsies can be done. Again, it requires the tissue. Now we can do it from the blood itself. It's called liquid biopsies. Without puncturing the tumor, you can even take the blood sample and find out whether the patient is having cancer, what type of cancer, what kind of treatment can be contemplated for that patient. All can be done with the help of a simple blood drawing. So this is very simple and very effective. We can obtain the same kind of information which you'll be getting from a tissue by doing a surgery or by doing a biopsy. The same can be done with the help of a blood sampling. So much of advancements and PET-CT scanners now come, which is can do the scanning of the entire body in 30 minutes, give you information. So much of advancement has happened in the last 3 decades, and we are now long way since we have traveled since 1980s and 90s. From 2000 onwards, the advancement, the science advancement has gone enormously, and the cutting edge research is happening in the field of oncology to move it further, and so much of advancements. And now any patients can have a treatment which is more precise and more personalized than at least a decade earlier.
Definitely, sir. It's more precise and it's more advanced as compared to the earlier treatment options we had. And now, because of the clinical trials and the researchers, which is going on day and night, so that we can have the better options to treat our patients and the healthcare professionals who are working tirelessly for their patients. So, with that, if you can specify some specific lifestyle factors that women often overlook but can significantly reduce their cancer risk, like we were talking a bit of earlier as well.
So for a woman, the most common cancer I told in India is the breast cancer. Number two is the cervical cancer. Number three is the lung cancer. So now we are seeing a trend of non-smokers having getting lung cancers. That's very important. So don't think that only smokers will get lung cancers. Majority of the women in India is non-smokers, but metros they have smoking histories of in the females also. But majority of the rural populations are non-smokers in India. Even then, that the increased incidence of lung cancers are occurring because of various factors, as I told you, because of the lifestyle. So lung cancers, rise in the incidence of lung cancers among the non-smoking population of women is also there. The breast cancer has now replaced the cervical cancer. Now the breast cancer is number one. The breast cancer, the self-breast examination is a very important tool a woman has got to identify the abnormality in the breast. So breast, as we all know, is a very external organ, is very easily accessible for the woman to herself to examine when compared to the other organs like the stomach, which may require a PET scan, which may require an endoscopy to identify. A lung requires a bronchoscopy. So these are the organs which are hidden inside the body, which may have the symptoms which may closely mimic the normal innocuous things. So they may miss it, but breast is a very external thing, and very easily it can be examined by the patient themselves while taking a bath, standing in front of the mirror while doing the dressing. They can find out the abnormality in the nipple. They can find out any discharge coming out of the nipple. They can find out any lump is sticking out of the breast. When they put their hands, palm of their hands, and they see there's any going to be any abnormality, they have to should not ignore. That's a very important point. These should not be ignored. And immediately, whatever may be the age, especially if it is more than 30, 35 years of age, if they are detecting any abnormality in the nipple, any discharge from the nipple, or any abnormality over the breast on putting the hands of palm of the hands of the breast, immediately they must go and consult the doctor, which will help in identifying the lesion as very early, and the doctor will may advise a biopsy to find out whether the patient has got a cancer or not. So this is very important. Breast is a very external organ, very easily accessible, doesn't require any great skill to identify it. While taking bath, if you put your hands while standing in front of the mirror, while dressing, you put your hands, and if you happen to see that breast, and you can find out the thing very important. Even though it's a very easily accessible organ, still like 70% of the patients in India land up in this advanced stage, that is stage 3 and 4. That is very not so great thing. Unlike the Western population, where these stage 3 and 4 are less than 15%, in India, the stage 3 and 4 patients are more than 70%. So their 5 year survival rate is less than 30%. If you happen to push those diagnoses at the early stage, in the stage 1 and 2, like the Western population, where 70 to 80% of the patients are detected at the stage 1 and 2, we can improve the survival to 90 to 95% as in the Western populations. We have drugs, we have surgeries are great, our radiations are great. To make it is 100% curable, we can even reach up to 95% in a case of stage 1 and 2. So it's very important. Self-breast examination nowadays is being should be part of the curriculum of the school for the young girls to identify the how to identify when they grow into a 30 plus of the age, and all the working women has to be commonly. That's a popular misconception. That cancer occurs in the old age, or cancer occurs only patients who has got a family history, mother is son. It's not like that. So they may have higher risk, but the cancers occurs in India. The most common age where the cancers gets occur in India is 40 to 50 years of age. This what you call as a young middle age, or most protective life of a human being is 40 to 50, and the ladies usually they settle down, get married, have kids. So this is the age by which they become more productive in their lifestyle, in their life, and they are the one where they have less time. They will be taking care of their husband, they will be taking care of their kids. They have to be very busy in their social life, and the very busy in their profession, or maybe busy in their family life. This is the time where they have to be very cautious and try to identify with the self-breast examination.
Thank you so much, sir, for sharing that importance of the factors which affects or can be the reason for the cancer occurrence. Sir, lastly, as we are moving close to end of our session, last question to you is: what advice would you like to give to women today, as it is an ongoing initiative on International Women's Day? So, what advice would you give to women to take charge of their cancer risk and overall health?
Cancer is not a death sentence. It's curable. I said to you, it's a 50% of the cancers are highly curable. Many of cancers, if it is detected early, can highly curable. The treatment modalities are advanced so much. Surgery, chemotherapy, and radiation now can be delivered more precise and personalized way, and with less toxicity. So even if you find some abnormality, especially in the breast, or you're finding something is there, nodes, or something is there, don't hesitate to go to a nearby doctor or to a consultant, cancer consultant, to do a biopsy. Or even if you don't want a biopsy, you can take a blood sample and you can identify these things, liquid biopsy. So these are the various things. Don't put your self-breast examinations, to do it periodically, do your viability or the pap smear periodically, do your all your annual master checkups at the age of 45, after the age of 45. Don't try to postpone those things. Don't, if you are finding some abnormality, don't hesitate to go to your family doctor or to a consultant to make a diagnosis of thing. Even if you are diagnosed in a advanced stage, or in the whatever the maybe the stage, there are treatments are available which will help you in mitigating those disease per se. And always there is a hope that you can be cured. Definitely the modalities have improved a lot, the science has advanced a lot. So don't get to the misconception that even an advanced stage is incurable, nothing can be done. You have to go, nothing can be done. The treatment will be more toxic than the disease itself. Don't get those kind of misconceptions. Whatever may be the stage of disease, the treatment can mitigate your disease, and it can give you a longevity of life can be improved even if it will not be curable. Many of the advanced stage disease can be made into a long-term disease by the help of modern drugs. It may can made into a chronic disease by a modern drugs, like how you take a diabetic drug and a hypertensive drug. Can keep taking the oral tablets are now available. which will help you increasing your lifespan, even if you're in the advanced stage of the disease. Always there is hope.
Thank you so much, sir, for sharing your valuable insights with us because we want more and more females to come out and take charge of their health. So this is our initiative to motivate them, to encourage them about, and make them aware about what all can be done and how they can take charge of their own health rather than ignoring it, having this all those misconceptions and myths in their head. So thank you so much for clearing those out, sir. It means a lot as it's an uh, together initiative that we are working on. So thank you so much for sharing your valuable insights and expertise with us on this important issue. Thank you, sir.
Thank you so much. Thank you, Simba. Thank you
Thank
to
you.
the entire team.
Thank you, sir.